Push for policy reforms on unpaid care work gains momentum in East Africa. Efforts to recognize and address unpaid care and domestic work in East Africa are gaining traction as advocates push for legislative changes to support women's economic empowerment. Researchers, policymakers, and civil society organizations in Uganda, Rwanda, and Ethiopia are working to highlight the economic burden of unpaid care work and drive policy reforms to ease the workload on women. In Uganda, Oxfam, in partnership with their Accord organization, has been at the forefront of efforts to influence policies on unpaid care and domestic work. Peace Emmaculate Channdini, women's rights coordinator at Oxfam Uganda, said that their initiative focused on policy advocacy, research, and capacity building among organizations working on women's economic empowerment.
We tried to generate infographics from data that was collected by the Uganda Bureau of Statistics way back, I think, around 2019. And through this, were able to generate infographics to make meaning out of, for example, the information that was generated in terms of how much time men spend on doing unpaid care work vis-a-vis how much time women spend on doing unpaid care work, and what impact, for example, this has on women economic empowerment. So we're able to generate those infographics and convene different partners, different organizations to try and share these infographics and also make meaning out of these infographics. We also tried to convene different policy legislators to try and influence policy change around unpaid care and domestic work, as well as women economic empowerment. Albeit we are not yet there as a country, we do not have a policy yet ultimately on unpaid care and domestic work. But we hope that as we continue to engage, even beyond this project, because we also have other projects, sister projects that may not necessarily be funded by IDRC, but there's one, for example, funded by the Hewlett Foundation, which we are still implementing, and we hope that we shall continue to still engage these legislators to try and pass policies that speak about unrecognized unpaid care and domestic work as a policy issue.
Research conducted by Oxfam and Accord revealed that women in Uganda spend an average of 4 additional hours per day on unpaid care compared to men. This time constraint limits their ability to participate in income-generating activities, creating a cycle of economic dependence.
Women were spending about 4 hours, I should say, more time doing unpaid care work as compared to women. So this meant quite a lot, because if women are spending more time doing unpaid care work, then it meant that they would spend little time doing work that would otherwise probably be able to bring in income to the household, and yet probably ultimately this household needs income.
One of the key recommendations from the research is the establishment of childcare centers near workplaces. Channdini explained that women are expected to exclusively breastfeed for 6 months, yet many workplaces lack childcare facilities. She says having these centers near workplaces would allow women to balance work and childcare more effectively.
Take a case where, for example, the mother is recommended to exclusively breastfeed for 6 months, and yet they have to walk miles or move miles to go and be able to work. So establishing a child care center near to her workplace will enable her to work, but also be able to at least go and breastfeed her child every after about 2 hours. So it allows you to concentrate on doing your work, knowing that your child is safe. So we made recommendations to ensure that these child care centers are established, are funded, and also maintained.
Additionally, organizations participating in the project were trained in gender analysis and auditing, enabling them to develop internal policies that support gender equality.
Different organizations that are doing work around women economic empowerment and care, and we trained them on gender analysis and gender audits. And after training them on gender analysis and gender audit, of course, this was done together with our code. They were now tasked to go and do a gender analysis of their own respective organizations and find out what gender issues there are, come up with action plans on how they are going to address these issues, but also probably come up with care policies within their different organizations.
Rwanda has made significant strides in addressing unpaid care work, with reforms culminating in its integration into the country's family law in 2024. The Institute of Policy Analysis and Research, in partnership with local women's organizations, implemented a 3-year project to assess and improve existing interventions. Eugenia Kaitesi, Executive Director of IPAR, says that the project, which ran from 2021 to 2023, focused on distributing water tanks, financial literacy training, and promoting family planning in Rwanda's northern districts.
So the project actually assessed we had a number of objectives. We were assessing the interventions that were already being implemented by Resolve Farm. They were being implemented, but at a smaller scale. So the interventions were to assess the distribution of water tanks. We distributed 550 water tanks to couples, meaning husbands and wives, with actually children under 12 years. We carried out education, sexually reproductive health. We educated them on financial management, entrepreneurship, and then family planning.
Kaitesi added that this not only improved household efficiency, but also allowed women to participate in economic activities. The project also led to a reduction in sexual violence against women, with cases dropping by 67.6%. Kaitesi noted that engaging men in unpaid care work has a profound impact on reducing gender-based violence and promoting household stability.
On sexual violence for women, this one considerably reduced by 67.6%. Another was on the time spent on unpaid care work, increased by 0.25 per hour by men. Men were able to participate in unpaid care work.
Through advocacy and engagement with Rwanda's Parliament and the Ministry of Gender, unpaid care work was officially recognized in the country's family law. She said that this is a major victory, but we are now pushing for the initiative to be scaled up to more districts.
So one major impact, actually result that we get is this was able to feed into the Rwandan family law that was developed in 2024. We really informed that law, and decisions were taken to include unpaid care work in the Rwandan family law. We're looking at scaling it up to other districts because the 5 districts where we participated is small, considering that Rwanda has got 30 districts. 5 districts is very small, and if it was scaled up to other districts, then it would really have a meaningful impact.
In Ethiopia, the Feminist research firm, include Ovid, implemented an 18-month project aimed at tackling unpaid care work and promoting women's economic empowerment. The initiative, funded by the International Development Research Center, identified a significant knowledge gap among policymakers on the issue.
So we conducted a knowledge attitude and practice survey within these identified 4 key ministries. And we found out the knowledge gap, and practice gap, understanding gap among key policymakers, particularly on the issue of unpaid care work.
To address this gap, the organization launched a capacity building initiative, training 52 mid and lower level policymakers. A major challenge identified in Ethiopia is the lack of access to organized research on unpaid care work.
We developed a capacity building initiative, training program, and with one of our consortium members, Women in Self-Employment, we implemented that initiative and built the capacity of around 52 policymakers in Ethiopia at different levels. Initially, we wanted to reach out higher level policymakers, but due to different challenge, we went for mid-level and lower level policymakers. But it turned out to be kind of a blessing in disguise, because though we were not able to reach the decision makers, but we helped build the capacity of the implementers, the actual implementers who would be doing the job.
Konjit says that they are working on creating a centralized platform where policymakers can easily access research findings and policy recommendations. Channdini added that unpaid care work is the backbone of our economies, yet it remains invisible in policy frameworks.
People don't know where, especially government sector, different sector which employees and officers don't know where they can go and try to get information, particularly in an organized manner, information that should be accessible to them, journal articles, published articles, and so on. So what we have done was we built a help desk, a help desk, and that help desk was meant to help. It was helping policymakers to raise tickets whenever they have questions about issues and concerns and things that they needed to get some sort of explanations. One of the approach that we took was advocacy. So we wanted through, with the help of one of our consortium members at this powerhouse, we developed, designed a number of message that could be transmitted through different social media platforms to reach still policymakers, to influence the policy, but also widening our reach and trying to also approach and transmit message and disseminate information about unpaid care work in women economic empowerment in the Ethiopian context.
According to Channdini, through sustained advocacy and collaboration, there is hope to achieve meaningful reforms that empower women and create a more equitable society.